Vietnam is holding off on a nationwide COVID-19 lockdown, even as infections there soar. At the same time, the Prime Minister says that political stability could be threatened if the outbreak isn't contained. Tung Ngo reports from Hanoi.
Outside a hospital in Vietnam's capital, Hanoi, these medical workers are taking deliveries of food and essential items to those locked inside. Under lockdown, none of the 3,500 doctors, health workers and patients behind these fences could get in or out. The K hospital is now one of the biggest COVID-19 clusters in Vietnam since the new wave of outbreak hit earlier this month. Some medical staff here said they are fine inside, at least for now. Another concern is what's happening beyond these fences. 16,000 people had visited the hospital with potential exposure to COVID-19 before the lockdown. Many had contracted the virus and started spreading within their communities. One such community is in northern Bắc Ninh province, 40 kilometers away from Hanoi. Some 200,000 people were forced to go on lockdown.
Xem là còn các cái ổ dịch khác hay không mới là cái sự cần phải quan tâm. Bởi vì chúng ta mãi chống dịch, quan trọng vào những ổ này mà nó lại xuất hiện các ổ dịch khác mà chúng ta bỏ lơi thì là rất là nguy hiểm. Trong lúc này nguy cơ nó cao bởi vì chủng là chủng mới của Ấn Độ và trong lúc này chúng tôi thấy rằng thời gian lây nó rất là nhanh.
Nearly 600 local cases have been reported in 26 provinces and cities across Vietnam, and local authorities are scrambling to contain it. Some provinces have also reimposed lockdown orders, but the central government is refusing to enforce a nationwide lockdown due to concerns over the economic impact of such drastic measures. As new cases surge, Vietnam is also increasing checkpoints and patrol along its border to prevent illegal entry to contain the spread of the coronavirus, especially from Cambodia, where many Vietnamese are trying to return from COVID-19 hit regions. Vietnam's Prime Minister calls for further vigilance against COVID-19.
Nếu như chúng ta không có những cái biện pháp nó cứng rắn hơn, nó mạnh mẽ hơn, nó tích cực hơn, bám sát tình hình thực tế hơn, và đặc biệt là vào cuộc của các ông chí bí thư cấp ủy, chủ tịch các cấp, tôi nói từ tỉnh xuống cho đến huyện, đến xã, cho đến thôn, bản, tổ dân phố ấp, báo cáo với các ông chí là phải phát huy cái tinh thần cao nhất, tinh thần là phải đánh chống dịch như chống giặc.
The country's latest COVID-19 outbreaks have multiple transmission sources. A primary source is from imported cases due to lax enforcement on medical isolation for foreign arrivals. When the surge of infections began in Vietnam 2 weeks ago, it coincided with a public holiday when public gatherings were permitted. Domestic travel during the holiday period also contributed to a wider spread of the virus. Vietnam has mounted on massive testing campaigns. Official data says the country has carried out about 18,000 COVID-19 tests in the last 2 weeks. But none of these cancer patients were tested. They are desperately waiting for COVID-19 tests. They have been receiving treatment at a hospital in Hanoi that is at the center of the country's COVID-19 outbreak. With the hospital under lockdown, that treatment is now disrupted, and many are worried they might have contracted the virus.
Chỉ sản liệu trình của cô là 28 mũi thôi, nhưng mà bây giờ cô chỉ sản 19 mũi rồi, cô vẫn thiếu, nhưng mà cô bây giờ lo lắng nhất là bây giờ bệnh viện cũng nghỉ này, xong cô sợ gián đoạn liệu trình ấy, cô bị sao nên cô rất lo cái đoạn này.
The patients here come from different provinces in Vietnam. For now, they are not able to return to their villages because of concerns that they could spread the virus back home. With some deteriorating as late-stage patients, COVID-19 has made their personal battle against cancer a more difficult one. Tung Ngo, CNA, Hanoi.